How to identify chronic kidney disease? To identify chronic kidney disease, first patient can have symptoms of chronic kidney disease, and the second one we can do is by lab measurements. In the lab we do the following tests. The first one is complete urine examination. In the complete urine examination, normally we check for if the patient has protein or sugar in the urine, or if the patient is leaking any blood or any pus cells, the white blood cells or red blood cells in the urine, we check. So normal patients does not have any protein or sugar in the urine, and the pus cells or the white blood cells and red blood cells are in very small number. If the patient has chronic kidney disease, they start leaking protein into the urine, and sometimes red blood cells and white blood cells appear in the urine. So this test will tell us that there is some problem in the kidney which is causing the leakage of protein and red blood cells, but this will not tell us what is the disease and what stage it is. So to identify that, next we will measure the kidney function. So we do by doing the blood test. In the blood test we measure the blood urea and serum creatinine. These tests will be done in the blood, and based on these levels we will tell the stage of the chronic kidney disease. So as the stage of the CKD increases, the serum creatinine and the blood urea levels increase. And coming to other tests, the next one is the ultrasound examination of the kidneys. So this is also to identify what is the cause of kidney disease in the patient. So in ultrasound, we will try to see whether the kidneys are located in the normal position or not, or if the track of the urine from the kidneys is it normal or not, is there any blockage of the urine track with the stones, or if there is any obstruction of the urine, we will see. And if the kidneys, if they are present, what is their size and what is their location, is there any abnormality in the structure of the kidney. Sometimes there can be cysts in the kidneys, or there can be a mass in the kidney, or there can be some abscesses. So these type of things will be identified in the ultrasound. So these complete urine examination, blood tests for renal function and ultrasound are the basic important tests to identify the kidney function and also to stage the kidney disease. And sometimes if the cause of the kidney disease is not known, we may have to do a renal biopsy based on the stage of the kidney disease and the duration of the kidney disease and the presence or absence of protein or red blood cells in the urine. That will help us to identify patients which require renal biopsy or not.